Hello. I will tell you about Peyronie disease using the story of one life as an example. A patient came to me. Born in 2002, a very young man who upon palpation discovered pain and curvature of the penis. Well, he looked and there was something he didn't like about it. He approached me first. He underwent an examination and an ultrasound of the penis with elastography was performed. A plaque of the tunica albuginea was discovered. The size of the plaque was 3 millimeters, located in the middle third without an acoustic shadow. Upon seeing this plaque, I realized and decided that this was the early stage of Peyronie's disease and the patient could be treated. There was perifocal inflammation around it. On palpation, the plaque felt like a round formation, painful to the touch, located in the middle third of the penis. The patient was prescribed additional examinations, biochemical, laboratory tests, blood analysis, and others. As a rule, in such patients, we do not see anything unusual in the general blood test or in any other additional studies. We might see a slightly altered PSA. His total PSA was 0.5. For a young man, that's a bit on the high side. PSA should be equal to 0. Your age. His testosterone was 23. For someone who's 22, a testosterone level of 23 is low, guys. That's barely enough to keep the soul in the body. And when does our testosterone drop? Our testosterone drops when we have prostatitis because cytokines are at work, and cytokines block testosterone production in the testicles. Based on this comprehensive information, as well as the detailed ultrasound results and the extensive data collected on trace elements, specifically, it was observed that the young man had significantly reduced zinc levels, and indeed, he did have a deficiency in zinc. One moment, please, while I retrieve further details. He had zinc, he did have zinc, he had zinc 9, with the normal range being from 11 to 19 nanomoles per liter. And based on these 3 indirect indicators, plus the ultrasound, transrectal ultrasound of the prostate, a conclusion was made that the patient had prostatitis. What happened to him? He suffered a microtrauma to his penis during vigorous sex with a girl in the woman on top position. And since he had prostatitis, this microtrauma began to progress pathologically. And despite his young age, against the background of chronic prostatitis, Peyronie's disease developed. Treatment was prescribed, specifically physiotherapy. As for the specific medications, I will not explicitly name them for you, so that no foolish individuals attempt to harm their bodies through dangerous self-treatment. I'll just say this. It was a group of resorptive medications. These were medications to support health during Peyronie's disease, and they worked very well. It was anti-inflammatory therapy aimed at stopping the pathological process. These were medications, a group aimed at treating chronic prostatitis. These were medications based on biogenic peptides, which I deeply respect. Thus, we managed to stop 2 processes at the same time. We stopped the chronic prostatitis. My goal was not to cure it completely. Now, if necessary, I would cure it for him. It just requires prolonged treatment. But with Peyronie's disease, the following happened. Around the 3rd to 5th day, the pain in the penis disappeared. About a week later, during an ultrasound, I saw that the perifocal inflammation had stopped. What does that mean? It means that the pathological process of plaque formation had stopped and it didn't progress any further. And our task was simply to heal it. And about a month later, we saw a normally formed, normal scar. Yes, in the penis it could be felt and it was palpable. If you really tried hard, kept feeling and probing, then basically something like a tiny needle, a thin formation, remained. But that's not a plaque. The process of plaque formation stopped, and Peyronie's disease ended there. We managed to stop it within a month. But I repeat, the young man was young and healthy. He sought help immediately. I wish the same for you. All the best.